Now I want to talk to you about lessons we can learn from other countries that are doing things right and lessons that we can learn where people aren't doing things well. If you look at the current state of affairs out there, Italy by far is taking the worst beating of anybody out there. And there's some factors to this. The first is that they have a really high population of older people. The second is they didn't practice social distancing early and serious when the first outbreak came. They isolated people in the north, but they didn't isolate them in the south, and they allowed for transfer between there. Culturally, they live with their grandparents. So you have grandparents and the parents and the children all living in the same space. Culturally, Italians typically don't, they're not real rule followers. So when you tried to batten down the hatches, a lot of them were like, not so worried about it. There's a high proportion of smokers and over obesity in that country, which predisposes them. There's also a very high proportion of anti-vaxxers in Italy, which I didn't understand, but there is a much higher rate of regular flu. So if you get the flu and then you get this, that's going to predispose you. So now what has happened is they have now had to make harsh decisions that nobody over 60 is going to get a ventilator. And I can tell you that if somebody's sick with this, they need a ventilator. And if you can't give it to them, that's why their death rate is so high. Now let's convert over to Germany and South Korea. But let's talk about Germany. Germany has almost the same amount of old people as Italy. And only Japan exceeds those countries as far as how many old people there are. But Germany has been very aggressive about social distancing. They're very strict rule followers. And they're also strategically testing everyone who's positive and everybody who they've come in contact with. So if you're positive, they'll immediately find out who you're in contact with, family, coworkers, etc. And then from there, who's ever positive, that they strategically test those people. So they're not going out and blanket testing everybody, but they're strategically going out there and knocking it down one at a time. Everyone who's positive quarantines for 14 full days. So their death rate right now is about 0.4%, which is almost like the regular flu. The death rate in Italy right now looks to be about 10%. So what we can take away from that lesson is, let's not wait for our government to tell us to social distance. Let's do it right now. Let's have 6 feet of spread between us. Let's do the hand washing. Let's not have our grandparents over for get-togethers. I was watching my neighbor yesterday. They had probably 3 people in the yard that were over 80, 4 grandkids and the parents, and they were all playing. Kids were hopping on Grandpa. Grandpa was walking around. I mean, this is not social distancing. That doesn't mean get together as a family and hang out together. You really got to isolate those that are the most vulnerable, because 80% of the time, you don't have symptoms. It's very likely that I've been exposed to this and I may have been carrying this, giving this to other people. So it's even more important for those of us that are healthy, that don't have symptoms, to assume that you're a carrier and act that way so that you don't give it to these other people. Now, we don't have enough tests right now, but when we do, we can mimic Germany and we can do what they did. You can also look at South Korea. They have a very low death rate. Apparently, they had been hit with the highest rate of SARS death in any Asian country back in the day. So culturally, when this hit, it was all hands on deck right away. They did over 300,000 tests in the matter of weeks. And what they did is they took everybody who was positive and they actually used GPS data from their cell phones to find out who they came in contact with, strategically tested them, quarantined the ones that were positive, and they're having a much, much better outcome than Italy has. So take-home message, really important to social distance. We're going to get tests. They're being made. These medications do look very promising, despite what you hear. I'm very optimistic about it. I think it's going to help. Vaccines are far away. But priority number 1 is social distance, so we don't overwhelm our healthcare. Masks and gowns are being made by companies. Honeywell and 3M have just ramped up production. They got a waiver so that they don't have any risk in play, so that's coming. So things are happening in the next 2 weeks. But you as a citizen, don't wait for your government to tell you to batten down the hatches and social distance. Do it, and if you've got somebody that's predisposed to getting this, do more of a quarantine. And let's keep learning week to week, and we'll keep giving you new content to help you get through this. Thanks.